her grandmother.
Yes, sweetie, I'm so sorry.
To consider that an epidemic that had taken hold in 3 different distinct countries was not an international epidemic because it hadn't spread to Nigeria, it really doesn't make sense. Also, at any moment it could have spread to Ivory Coast, to Mali, which it did briefly, and to Senegal. So what is the limit for WHO in terms of national or international epidemic? This was clearly an international epidemic, and it's really a shame that somehow WHO and the international community only woke up when Westerners were infected and had to be medevaced to Texas or to Spain. If even the World Health Organization filters its health declarations through a political or economic lens, then it really leaves people defenseless somehow. It also makes our job as a medical organization much harder, because not only do you have to convince the governments that they're facing a serious crisis and they have to call for help, but you also have to convince the World Health Organization itself. You haven't sorted the problem out, you haven't reached the end of the problem until you've traced the last patient, you've traced the last contacts of that patient in the last village in Sierra Leone or Guinea. And today we are facing a worrying situation because there's a reticence in some parts of the community still in Guinea, around Conakry, and in northern Sierra Leone, and there could be cases being hidden and underreporting again taking place here at a community level, and that can fuel the epidemic for many more months to come. We're reaching a critical phase where we've seen the number of cases reduce, but we mustn't let our guard down. So we really have to pursue every single contact, every single case now, especially as all you need are one or two cases in Guinea or Sierra Leone to travel abroad or to go into a certain kind of environment where there's a low level of knowledge locally for this to flare up again. The main priorities will be to strengthen the work with the communities in and around Conakry, to strengthen the epidemiological reporting, to remove the stigma, also to depoliticize any aspect of the response and really rebuild trust with the communities.
So you can better